Going to talk about thick hair FUE transplant and everything that has to do with the quality and thickness of hair. I'm Dr. Parsa Mohebi, a hair transplant surgeon based in Los Angeles and San Francisco. I'm going to review the quality and thickness of hair in hair restoration procedures, especially FUE procedure, and what does it mean when you have fine hair and thick hair. People come to us for hair transplant procedures, men, women with pattern hair loss, that they're losing hair on top and they have good quality hair on the back. So they come to us and ask us what we can predict about the result of the hair transplant they should receive. A lot of the volume of hair and what makes the final result of hair transplant has to do with thickness of hair. So people who have finer hair, they should expect less volume with the same number of grafts as people who have thicker and coarser hair on the donor area. I'm going to review with you our patient that is getting a hair transplant today. We're going to talk about how we approach this patient who had a thick and coarse hair on the back and what are the advantages and disadvantages of having thick hair on the donor area. So the procedure we have today is a gentleman with class 6 or 5 or 6 that he is losing everything on front, top, and crown. As you can see, the front is completely gone. We have to reconstruct that hairline with a more natural, youthful location. And then we're going to go all the way back to the middle of the top and fill it all with transplanted hair. He does have this area on the crown area that we are not planning to restore today. We're going to give him finasteride, the medication that helps him get some more density to that area, and hopefully down the road he can get another hair transplant and fill that area. So this patient has very nice and thick hair, probably on top 10 percentile on the thickness of the hair shafts. So that makes the back of the head look like that horseshoe pattern. So since we're not transplanting the crown area is going to stay like this, maybe getting a little bit better with the medication, but the donor area looks so dense and so thick that keeps that horseshoe pattern. So male pattern hair loss is when people lose the front and top and the back and sides are staying healthy. So like in this patient, he has nice and coarse hair on the back and sides, and the top he doesn't have much hair. So the crown area will be visible because the back is very coarse. So now when we do FUE hair transplant, not only we put hair on the recipient area and give the appearance of having full head of hair, but we can reduce the density of the hair on the donor area. That kills two birds with one stone. Basically, we reduce the density of the back and add it to the front so we can minimize the appearance of that horseshoe pattern. We're covering a big area of the scalp with 2,500 grafts. So what happens, I can go all the way to the top and cover the whole area. 2,500 is a good number, but not for this huge area of the scalp. But when hair is thick and nice and coarse, we can expect that hair to give us more volume. So what's going to happen with this procedure, we're going to have the whole front nice and dense. The donor area that's nice and coarse, we decline the density a little bit. It's not to the point that he has minimized that horseshoe pattern, but in the future when he get another hair transplant to cover the crown area, we go another round and extract some more and put on the crown. So all of a sudden we're going to have like 50% density on front and top, which is great, and the donor area won't be 100% density either. We'll probably decline, drop it to 60 or 70% density, which minimizes the contrast between donor and recipient area. I hope you learned from this video on thick hair or quality of hair for hair transplant procedures. If you have any comments or questions, put them in the comment section on the video. Also be sure to follow us on our social media if you want to stay tuned with the new advances in hair restoration and hair restoration procedures.